You probably already know that exercise helps to manage blood sugar, but the type of strength program design that's best for diabetes is typically not discussed in a doctor's visit. Today I'm going to walk you through how to design an effective push-pull strength training program for diabetes aimed at managing blood sugar, insulin resistance, and improving balance. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. Push-pull strength program designs, they're commonly used in athletes, military personnel, and first responders as they focus on improving physical function, meaning the ability of the body to move rather than focusing on muscle groups. Since physical function tends to decline in diabetes, including the ability to balance on one's own 2 feet, push-pull strength program design, that's the way to go for diabetes. My research team published the first proposed push-pull movement pattern definitions for strength training in the scientific literature, and I'm going to walk you through how to incorporate different exercises for each of the 8 categories. Since my research team previously showed that in prediabetes and type 2 diabetes, doing strength training 2 to 3 days a week, that's going to be sufficient for improving cardiometabolic risk factors, and it also aligns with current guidelines. So today I'm going to show you how to create a push-pull program for a 2-day-a-week program as well as a 3-day-a-week program, depending on what works best for you. And at the end of the video, I'm going to explain why this specific program design is going to be best for diabetes. The first movement pattern is a knee movement, and this is going to refer to lower body actions directly involving muscles moving the knee joint. This category is going to include multi-joint exercises like squat, different lunge variations, and leg press, as well as single joint exercises like a leg curl or a leg extension. The primary muscle groups trained are the quadriceps, hamstrings, and glutes. For a 2-day program, include a variation of a squat like a back squat or a dumbbell front squat on day 1 and a version of a lunge on day 2. I like including a side lunge here because we're changing the direction to more of a lateral movement. For a 3-day program, include a squat on day 1, which is our push day, and a lunge on day 3, which is a combination of push and pull exercises. The second movement pattern is a shoulder and elbow horizontal push movement, which refers to actions applying force to an object that subsequently moves away from the body in a forward or rearward direction relative to the body's center of gravity and postural alignment. This is going to include multi-joint exercises like bench press variations, push-up variations, as well as a floor press, and single joint exercises like a chest fly. The primary muscle groups trained are the chest, anterior deltoid, and triceps. For a 2-day program, include a bench press on day 1 and a push-up or a chest fly on day 2. It's fine to alternate the push-up and chest fly each week. For a 3-day program, include the bench press on day 1 and the push-up or chest fly on day 3. If you want to help support the channel and maybe help yourself stay motivated, check out the link to these diabetes resistance t-shirts down in the description. The third movement pattern is a shoulder and elbow vertical pull movement, and this refers to actions applying force to an object that subsequently moves in an upward or downward direction toward the body's center of gravity and postural alignment. Multi-joint exercises from this category are going to be things like lat pull-downs, pull-ups, and upright rows. And if we're looking at single joint exercises, that's going to be movements like bicep curls and shrugs. The primary muscle groups trained are the back and biceps. For a 2-day program, include a lat pull-down on day 1 and an upright row on day 2. This ensures that we're training the muscles to pull upward and downward. For a 3-day program, include the lat pull down on day 2, which is our pull day, and an upright row on day 3. The fourth movement pattern is shoulder and elbow vertical push movement, which refers to actions applying force to an object that subsequently moves away from the body in an upward or downward direction relative to the body's center of gravity and postural alignment. Now for this category, some of the multi-joint exercises are going to include a shoulder press, dips, and handstand push-ups. And if we're looking at the single joint exercises, you can think of things like a French press, which is essentially a tricep extension, as well as a lateral raise. Primary muscle groups trained are the medial and frontal deltoid, chest, and triceps. For a 2-day program, include a press, which is commonly known as a shoulder press on day 1, and a French press on day 2. For a 3-day program, include the press and frontal raise on day 1 and the French press on day 3. The fifth movement pattern is a shoulder and elbow horizontal pull movement, which refers to actions applying force to an object, which subsequently moves towards the body in a forward or rearward direction relative to the body's center of gravity and postural alignment. different multi-joint exercises for the horizontal pull category. It's going to be different row variations like a bent row or a face pull, which is essentially a high row. And then for the single joint exercises, this is going to be things like a reverse fly or a banded pull apart. Primary muscle groups trained are the back, biceps, and posterior deltoids. For a 2-day program, include a reverse fly on day 1 and a single arm dumbbell row on day 2. For a 3-day program, include the single arm dumbbell row on day 2, which is our pull day, and a high row on day 3. If this video is helping you out at all, please consider subscribing to the channel as well as hitting the like button. The 6th movement pattern is a hip movement defined as lower body actions directly involving muscles moving the hip joint. Hip movements are going to include multi-joint exercises like most deadlift variations, as well as the bridge exercise. And single joint exercises are going to be any type of hip adduction movement where your leg comes out to the side, as well as good mornings. The primary muscle groups trained are the hamstrings, glutes, hip adductors, and hip abductors. For a 2-day program, include a bridge on day 1 and a variation of a deadlift like a Romanian deadlift on day 2. For a 3-day program, include a banded hip abduction on day 2 and a Romanian deadlift on day 3. The 7th movement pattern is an ankle movement defined as lower body actions directly involving muscles moving the ankle joint. Ankle movements are mainly going to include different variations of calf raises or heel raises, but they can also include ankle movements that are more common in rehabilitative settings like ankle inversion and eversion. Keep in mind that the ankles act as stabilizers in all standing exercises, and plantar flexion of the ankle occurs in a lot of multi-joint knee and hip exercises like squats, lunges, and deadlifts. The primary muscle groups trained are going to be the calves. For a 2-day program, include a heel raise or a calf raise on day 2 because you've already worked the calf quite a bit through other multi-joint exercises. For a 3-day program, include a standing heel raise or a calf raise on day 2 and a seated calf raise on day 3. The 8th and final movement pattern is a torso or vertebral column movement, defined as upper body actions directly involving muscles that move the torso. Torso movements are mainly going to include different variations of abdominal exercises that act to flex, rotate, and laterally bend the vertebral column. But it can also include exercises that act to extend the vertebral column, like exercises like a Superman, which essentially works the back musculature. Similar to what I was saying about how the ankles act as stabilizers in all standing exercises, the muscles of the torso are going to act as stabilizers in all strength exercises. For a 2-day program, include an abdominal crunch on day 1 and a bicycle on day 2. For a 3-day program, include an abdominal crunch on day 1 and a Superman on day 2, bicycle on day 3. Now I'm going to break down why this specific program design is so good for diabetes. Unilateral leg and hip movements, and what I mean by unilateral is you're working one limb at a time. So think about lunges, thinking about Bulgarian split squats. These really help to improve balance, and that's important because neuropathy is highly prevalent in diabetes, and it's neuropathy that causes people with diabetes to start to lose that balance. I include primarily multi-joint exercises like a shoulder press because these types of exercises, they're better at mimicking everyday activities in life, so they're better at improving physical function, and they also require more muscle activation and more strength in order to perform the movements, and they're also better at lowering metabolic stress and reducing injury risk compared to single joint movements. Now, I also included single joint exercises because these types of movements, they're good at isolating a muscle group, which helps to improve muscle imbalances. They're typically easier to learn than a lot of multi-joint exercises, and they're good for increasing muscle size, which is critical for improving insulin sensitivity. Strength programs that include primarily multi-joint exercises, but also include single joint exercises, these types of programs have consistently been shown to improve A1C compared to other types of program designs. If you have access to different types of equipment like barbells and dumbbells, it can be beneficial to mix this equipment up. Meaning, like if you're doing a shoulder press, do a shoulder press with a barbell some days, do it with a dumbbell on the other days. You can move more weight if you're using a barbell, but the dumbbells help to correct for muscle imbalances. If you want to learn more about how to design your strength training program, like how many reps should I be doing, how many sets, what should the rest periods be, how much weight should I be lifting, check out this video right here for strength training program design. Thank you for watching.